I want to bring in NBC News medical contributor, Dr. Kavita Patel. Doctor, good to have you with us. Let's start right there with this travel ban, these restrictions taking effect tomorrow. The situation in India has gone from bad to worse. Do you think this should have happened earlier in order to protect the U.S.?
Yeah, Joe, great question. And I think travel bans in general, as you heard here talk about, can be problematic and often do not actually improve the situation. If we were going to do it, it certainly would have been when we saw this uptick, not when we're coming through the throes of like the complete disaster. And just to put it in context, even 500,000 cases in India, one, it's an undercount, Joe. Two, it's a country of 1.4 billion people. So this is likely to get much worse before it gets better.
Dr. Fauci makes a point of speaking directly to the media for the community that needs to get the message. And he had a message for the Indian government and said this to the Indian Express: literally lock down so that you wind up having less spread. Now, India's health system could reach a breaking point. What do they need and what should we be doing more of?
Yeah, great points all around. Even if we sent all our excess vaccine, Joe, it's not enough. And I'll just be candid. This is a situation that you cannot vaccinate your way out of. You really do have to go back to basic public health measures, which is why you heard Dr. Fauci locking down. In addition, Joe, people do need to have better education. There's so much misinformation about when to wear masks, how to safely isolate, what to do if you're starting to feel symptomatic, but you don't necessarily need to go to a clinic or a hospital. And then the third thing we can do is make it much easier to test. Even though testing is widely available in the United States and most developed countries, parts of India have still had zero access to testing, and they're starting to limit testing in many parts of India to only symptomatic people, Joe, which we know from our experience a year ago does not catch the asymptomatic spreaders, which can be the biggest reason for the cases to rise.
Why is that happening with testing? Is it a resource issue right now?
Yeah, it's a combination of resources. Remember, these same tests are actually depending on some of these raw materials that the entire world is depending on to get their own COVID tests. So we're talking about things like plastic bags and tubules, ironically, that we need to get more supply for. And India also, ironically, Joe, is one of the largest exporter of drugs and vaccines. So this is a country that knows how to manufacture, but not when the entire world has a need. And we are seeing cases rise. It's not just India. We're seeing cases rise in countries that were doing well, like Japan. So this is becoming a more important issue for the U.S. to try to step in and help figure out how to get the message on basic measures and testing straight soon.
And Dr. Patel, I know this is personal. This crisis hits close to home for you. What are you hearing from your family in India, and what do they want us here in America to know?
You know, India is I'm proud to come from India. It's a very dignified country. I've never seen such pleas for help. They're begging for anything. And because I'm a doctor, what's happening every night is that a bunch of us U.S.-based physicians are getting on telephone calls with physicians based in India who are not used to taking care of COVID patients, Joe, because even despite being vaccinated, many of their workforce are still getting sick or positive. And so they are down so many people and trying to deal with a surge. We're just giving them basic help and advice, and they want to understand how to keep themselves safe. So they're looking for just basic facts and information, and we're trying to accommodate that. And luckily, many of them speak English, so it's easier to do that knowledge transfer. But again, when you're talking about the scale of the crisis, it has to happen 24/7. And that's another need. We can send personnel there in the form of workforce to help give extra hands on the ground.
Well, we're so glad you're there to help those doctors and to continue to help us understand what's happening. Dr. Patel, thank you so much. Appreciate your time this morning.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here. And click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.